All right, so now it's time to talk about my next day. So that was Wednesday, and now Thursday was my occupational therapy visit. And so I got a chance to meet my occupational therapist for the first time. That was great. And this one was just really about evaluating me where I'm at. She did a lot of measuring. She compared, the my arm measurements and stuff like that. And I think you can see that I don't it visually it doesn't look like I have much swelling. But she did say that some areas were just slightly so, but I don't have lymphedema yet. But she talked about that. She was like, it's not if you have it, it's when you have it. She was saying that, usually it happens. We just don't know when it's going to happen. And so it was good that I'm starting this early so we can stay ahead of it. And then I say if. I know she said when, but I'm gonna say if it happens, uh, it won't be as bad because we're ahead of it. So, anyways, the other thing she talked about is um, that maybe I can get like a medical alert, a ban or something like that because I can't have blood pressure taken from this arm or blood drawn from this arm. So I will be looking online for that. I have some nice jewelry for my right arm. I feel like I need more than that. I feel like, like for instance at church, where the pastor is like, tell your neighbor, give your neighbor a hug, high five your neighbor, all that stuff. And I don't think they really realize that sometimes people are undergoing something medical that they can't do all of that. Grab your neighbor hand. Oh my God, I don't. Okay, this is my. I'm just gonna tell you raw. I don't know what I'm gonna do if somebody grab that right arm, that right hand. Hopefully, I'm nice about it. But I just, hopefully, I'm like, oh, don't touch, don't touch. Hopefully, I don't have like a and like hit them or something. Ooh. No, I think I'll just be like, ow. But I think they should say, I don't know, but yeah, hopefully nobody touched that area. Like, um, yeah. Anyway, sorry, sidetrack. um, but yeah, what was I talking about? The medical alert. Yeah, so I was feeling like I need like do not touch. Like I need a sleeve that just say do not touch. Make sure nobody touched that arm. It is still sensitive, and yeah, don't touch my arm. Oh man, that just reminds me of the conference that I'm going to. Huh, that's gonna be interesting. Anyways, I'm sure I'll be able to manage it the way I've been managing. When people want to give me a hug, I do this to make sure they don't hug on this side. And then if they touch that side, I'm like, oh, be careful. I had surgery over there. Or I try to tell them in advance, hey, I had surgery over there. So that's probably how I'm going to do it when I'm at the conference. And as soon as I sit, the person who's sitting next to me, I'll let them know in advance, hey, I had surgery on the arm. Don't touch it. Don't try to hold this hand. Because, they always like, hold your neighbor hand, right? So I'm going to be like, don't touch it. Don't hold my hand. There's not going to be high fives with this hand. Please don't be offended because, some people can be offended, right? Like, oh, she thinks she's, whatever. And so just keep that in mind. They could be going through something and maybe they don't want to disclose it. And that's okay. They don't have to disclose it, right? So just give people grace when you want to like hold their hand a high five and they just really don't want to do it. There could be many reasons why, and it could be a medical reason that they just don't want to tell you about. And that's fine. That's if they don't want to share, they don't have to share, right? So just give them grace if that has ever happened. And I know me from experience, I'd be like, man, they got like attitude. Sorry, Lord, please forgive me, those people. I don't verbally tell them that, but in my mind, I tell them. But now I'm like, oh, it could have been so many reasons. So now I'm giving grace, right? And so I'm just telling you, you may not ever have those thoughts. It could just be me, but just in case, give them grace. You never know what they're going through. Anyway, so I told her what my radiation doctor told me, and radiation oncologist doctor told me, and she was like, "Oh yeah, we can see if your insurance will cover." Blah blah blah. I was like, "Wait, I have Japan coming up in about 2 weeks. I need it pretty fast." And she was like, "Oh, okay, then you probably want to try to skip the insurance." And she gave me a website, and she's like, "Let me go ahead and measure you now." So it's very important that you communicate like what your plans are, because they can help you. So if I wouldn't have communicated that, hey, in 2 weeks, then she probably wouldn't known to like measure me that day. It wasn't on her agenda to measure me, right? So make sure you communicate. Don't hesitate. Don't be afraid to communicate with them. So she did go ahead and measure me, and told me the website that's good to order from, and went through that whole process to make sure I have the right size. So that was great. Thank you. All right. Anyways, and then, oh, she said no hot springs. So remember, my radiation oncologist talked about the springs. I was so excited about the springs, right? And then she was like, no hot springs, no jacuzzi, because I told her I was going to be traveling, anything that I need to be aware of. And I was like, no hot springs? I was like, I was planning on doing a hot spring. So no hot spring. I wonder if I can just put my feet in it. Can I just put my feet in it? You know what? I have another meeting with her before I go to Japan. So I'm going to ask her and say, can I just get in like waist down? Just make sure I don't do my upper body. Would that be okay? Oh, I really want to get in those springs. I love springs. I don't know if their springs are different from here in the U.S., but yeah, I love springs. Anyways, hot springs. So I'm going to check on that. Let me put that as a question. But the first meeting was really good. And then I was able to meet with her again on Friday before my meeting with my oncologist. And that was like a spa. That was nice. And so she did like these rubbing things, and she was kind of like releasing. And I was like, man, I feel like I'm at a spa. It was like nice massages. I was like, this is great. The spa came first, and then the work came. I call it spa treatment. Anyways, it was great. And then, but before my second visit and my first visit, I talked to her about, the feeling I was getting when I did my arm like this, like my arm didn't want to bend. And she said I could have started with cording. Um, and so she was like, no problem. She'll work to try to pop that. I was like, ooh, pop that. That sounds bad. I was like, no surgery, right? She was like, oh, no, 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 no surgery. Because in my mind, I was like, oh, pop it. What do you mean? You got to go in and cut and, ugh. She's like, no, no, no. There's things they can do to pop it. But I can tell you, I don't know if it's popped yet, but I can actually put my arm down a little more. Yay. So back to my second visit, she was able to do a lot of stretches. I got some instructions of stretches for me to do to help with my arm. I meet with her again or the following week, because she have a funeral, unfortunately, that she has to attend, so she's going to be out. So when she get back, I think I meet with her one more time before I go to Japan, and then of course, after I come back, we'll continue. And she did say if I, am doing chemo, I can still do this as well. She'll kind of coordinate. You know how I feel about chemo. I don't know yet. Let's see. Let's see. Anyways, yeah, that's it. I just want to give you this quick update. It's not quick, but I try. All right. Thank you. Next is my visit with my oncologist.